Hello and welcome to this webinar on OTHM University Pathways in Health and Social Care with the University College Birmingham. Today we are joined with Alma and Zoe from the UCB team, as well as Rebecca from OTHM. Before we crack on with the webinar, I'd just like to go through a couple of housekeeping points. So there will be a Q&A option available, so please do drop your questions in there throughout the duration of the webinar, and we will come back at the end of the session to answer those. The session is also being recorded and will be uploaded to our YouTube channel, so you can watch this on demand over the next couple of days. And there will also be a survey that will pop up at the end of the session, so please do fill that out because that will be really helpful for us when we're conducting webinars like this in the future. That's enough from me. I'll just now allow Rebecca to start us off.
Thanks, Tom. I'll just be starting off today by giving a brief introduction to OTHM for all those who are perhaps new to OTHM. So we are a UK-based Ofqual regulated awarding organisation. We work with approved delivery partners in over 70 countries and we offer over 100 qualifications. We cover quite a diverse range of subject areas and we offer qualifications right from level 3, so foundation level study, all the way up to level 8 doctoral level study. And just a little bit of information here on the levels and their equivalency. The focus of today's webinar is the pathway from our level 4 and 5. So just to explain a little bit, that our level 4 is equivalent to year 1 of a UK bachelor degree, and our level 5 is equivalent to like the second year of a UK bachelor or a HND. So we have the level 4 and 5 as separate diplomas. We also have a level 5 extended diploma, which is simply the levels 4 and 5 combined into one. And you can also see our higher level qualifications. We have level 7 and level 8. So today we're going to talk about our level 5 extended diploma in health and social care management, which leads on to the health and social care honours top-up at University College Birmingham. And I just wanted to highlight to you some of the modules that are studied across the level 4 and 5 in health and social care management. So the objective is to equip learners with the underpinning knowledge, understanding and skills required for a career or further study in health and social care sector at managerial level. And across the level 4 and 5 units, learners will gain a total credit value of 240 credits, so 120 for each level. The level 4 units kind of lay the foundations of learning by providing an introduction to contemporary health and social care topics, and the units combine both theoretical and practical knowledge in the profession and aim to develop and enhance knowledge and skills in the areas of equality, diversity, professional development, patient assessment, resource management, communication, as well as health and safety. The level 5, then the units give the learners the opportunity to progress in specific occupational areas as well. So we are thrilled to have our representatives here from University College Birmingham today to tell you a little bit more about the university itself and also their health and social care top-up as well. So I'm going to pass over to Alma and Zoe.
Hopefully you can see that okay. Good morning all, my name's Alma. I'm the Director of Marketing and Admissions here at University College Birmingham. I'm just going to give you a bit of an overview about the university and I'll hand you then over to my colleague Zoe, who's going to be talking about the top-up course. Just going to quickly share this video with you.
In the city of 1,000 trades, we focus on real skills for real jobs. We at University College Birmingham, we've invested over £200 million in our facilities, with over 230 courses and over 8,000 students from over 90 countries. We work with over 1,000 employees, with over 500 apprentices, delivering over 2,000 industry-based placements each year. We are multicultural, diverse, a microcosm of the region we serve. We are engineers, teachers, leaders, builders, practitioners, and entrepreneurs. From Birmingham to the South Pole, our impact is everywhere, literally. Winners at the What Uni Student Choice Awards, winners at the Student Nursing Times Award. We nurture the community we build here, and the proof is in the pudding. Our alumni are Forbes 30 under 30 listers, MBE receivers, social media stars, Olympic athletes, and MasterChef winners, and we are proud of each and every one of them. We are drivers of substantial economic impact, nurturers of budding talent, experts in vital industry knowledge. We at University College Birmingham.
Okay, hopefully that's giving you a bit of a flavor as to what we are about. We're a very practical based university. A lot of our courses are known for being rooted in hands-on practical delivery. We are based in Birmingham city centre, the most central university you'll find in Birmingham. Some of these landmarks I've shared here are literally a stone throws away from our campus. So you can reach us very easily by train or bus network or motorways. We support students in every which way possible. I think one of the things that's really special about UCB is that there is no such thing as a closed door or office hours. You can access our staff at any time to suit you. One of the things that we offer that you would also be eligible for is the Kickstart, which is a financial support of £300 for every student, up to £800 if you're earning less than £25,000, where that you can spend on course essentials, food outlets, travel, and various other things on campus. Our next open day, apologies, this was just Saturday, just gone. Our next open day will be the 15th of August, which you can register for or clicking on that QR code there. I will now pass you over to Zoe.
Hi everyone, my name is Zoe Hodgson and I'm the programme lead and senior lecturer for our level 6 in health and social care, BSc honours degree, our top-up year and also our foundation year. So I'm going to tell you a bit about our course, what it involves, what you'd be studying, how it would be assessed. So programme leads on to a lot of different rewarding careers. I'll explain some of the examples of roles our graduates have gone on to, because everyone isn't always that clear about the sort of job roles that are available in health and social care. But all of them are about making a real difference to people, often with really quite complex needs. The degree does focus more on social care than health, because those are the types of roles that it leads to. People want to work in medical roles and you need to do a clinical qualification. So they do lead on to more working in community type settings. So the degree takes a holistic view of health. So holistic means whole. We're not just looking at physical health, we're also thinking about people's mental health, their emotional health, societal health. And we combine that specialist knowledge with practical experience to prepare you for a wide range of different careers or potentially further study as well. This is our health and social care teaching team at one of our recent graduations. So all of us are experienced health and social care practitioners. So we've all worked in the sector. Personally, my background was working in addiction treatment. Because we've all worked in the sector, it helps us to give you a really good understanding about the subjects that we're looking at, how things actually work in practice. And it also means we can offer specialised modules, so you can choose options in things like neurodiversity, criminology and mental health. And it's only really because we've got that specialised experience that we are able to offer that. We also co-deliver our programme with experts by experience. Now, they are people who have used health and social care services themselves. So they might have a learning disability or a mental health problem or an addiction issue, various different things like that. So they're users of health and social care services. Now, in the sector, in the health and social care sector, we use experts by experience a great deal. And we have that logo, nothing about us without us. So no decisions should be made in the sector about how services are run, people are worked with, without asking the service users themselves. That is how the sector runs, and it's really good practice to use that. Now, health and social care courses don't have a requirement that you have to have experts by experience. Some courses, such as nursing, do. Health and social care doesn't, but we just feel it's a real gold standard approach to have them as part of our degree programme, because it's what happens in the sector. And we just get such brilliant feedback from the students about having our experts by experience. They come into lectures, they might just share their experiences, they might do practical activities with you so you can develop your skills about how you work with people in certain ways. Sometimes they might be involved in giving you formative feedback, so helping give you feedback about about your assignments, giving context to what you're talking about, and also they are involved in some assessments as well. On our health and social care course, you will be required to complete a vocational placement. Now that is 1 day a week throughout the whole of the year, and the reason that we have so much placement experience on the course is to massively boost your employability. In health and social care, you simply can't get a job unless you've got vocational experience as well. Your qualifications get you so far, but because you're working with people who are really complex and often quite vulnerable, people need to have experience as well. Recruiters will ask you to give them examples of when you've worked, when have you adapted communication with somebody, when have you supported somebody through this, and you need to be able to give examples of that, and you can't do that if you haven't got some vocational experience as well. At UCB, we're really lucky to have employability tutors, so we've got a dedicated team whose job it is to help you find your placements and support you when you're in them, and not all colleges or universities have that, so we're really lucky to have that. On the whole health and social care course, we have at any one time about 200 students out in placement, and that means that we've got loads and loads of connections and partnerships with local employers that we work with to support you to find a successful placement. Another reason why placements are so important, because there is a lot. Often in health and social care, you don't know if you want to do a certain job until you actually do it. So it's really useful to help you work out the part of health and social care that you want to work in, the bit that's your passion. And so to go into placement, that can really help you work out what it is that you do want to do. Sometimes some of our graduates work part-time in the health and social care sector, and they can use that as their placement hours if they want to as well, to give us a bit more flexibility. And all of our students, no matter how they do academically, tend to be absolutely outstanding in practice, so when they're actually in their placements. And because of that, the appraisal that you will get at the end of your placement will count towards a module grade. So your practice can be recognised as part of your classification in your degree as well. We also, on the course, offer a range of enrichments. Now, enrichments are extra things that you can do that are optional, but just to help really boost your understanding, your experience, and give your CV a bit of an edge, have extra things on it and extra knowledge. We offer enrichments in things like mental health first aid, basic life support, communication differences, autism awareness, infection prevention and body systems. None of them you have to do, they're all optional. So this is what you will actually study if you choose to do the top up with us. So the course is split into 2 semesters. Semester 1 is from September to January, then semester 2 is from February to May. So you'll study 2 modules each semester. They're both worth 30 credits, so that's why we only need to have 2, because at level 6 it's really useful for us to be able to explore subjects in sufficient detail for you, which is why it's useful to have them as 30 credit modules. So the first module you would study in semester 1 is leadership in health and social care, which hopefully will move on nicely from what you've studied in the level 4 and 5. That module looks at management theory and approaches, ethics and legal considerations, planning and change management, HR management, and the assessment for that is putting together a training package for staff. Imagine a health and social care setting. I will say about our assessments that we do have no exams on the course, which is often people are quite pleased about. But the assessments all try to be really vocationally focused. So they're focused on the skills that you're actually going to need in practice. And they are quite varied. So leadership is the training package. Then you also do a module in counselling and guidance skills. Counselling skills are different than being a counsellor. Any role that you do in health and social care, any role when you're working with people, you need really effective counselling skills. Often in those roles, if you can't get people, you need people to be able to feel comfortable enough to talk to you and share often really personal things with you very quickly, so you are able to meet their needs and do your job. So counselling skills are really, really important. Your ability to communicate is one of the most important skills you need as a health and social care practitioner. So we look at counselling and guidance skills. That is quite a practical practical modules, so we have a lot of skills practice. Part of your assessment is about your ability to demonstrate those skills and your ability to develop a therapeutic relationship. We also look at different counselling approaches, counselling theory, also at things from a counsellor's point of view. So how do we keep ourselves safe? How do we have boundaries that we need, sort of the ethics and values we need to follow, and that type of thing. Then in semester 2, you would have an option to study either mental health, criminology and offender management, or neurodiversity. This is your chance really to specialise in an area that is I would either choose an option which is most related to your chosen career path, or if none of them do, or you're not sure, I would always advise people to choose the option that they're most interested in. The area you're most interested in, you're most likely to be more successful in it, basically. So these options, are a chance for you to specialise in what you're interested in. They're all delivered by people who've got an expert background in those areas. And then the final module you'll study is a research project, applying research in health and social care. Now, I did see earlier that you do study research skills at level 5, so that's brilliant, because it gives you a background and understanding of research terminology and processes. So the research project you carry out here will be based in your placement, so it will have the aim of improving things in your placement in some way. So it might be that you're just going to find out how things could work more effectively for the organisation, or you might be researching something from the point of view of the service users or the clients, how things could work better for them. But it should have the overall aim improving things for the service or the service users. These are examples of the different roles that our graduates move on to. Quite wide ranging. So we've got things like a mental health advocate. There's a lot of roles in mental health at the minute, working in drug or recovery work, health education, working in housing support and homelessness services, working in wellbeing roles, domestic violence. A lot of our placements in places like Women's Aid, for example, working in family support, as behaviour mentors, community outreach. Some of our students work with refugee asylum seekers or work for disability rights in social action, team support, early actions kind of interventions with families before they need safeguarding, learning disabilities, social prescribing, pastoral leads, and lead practitioners. I can see the little error there, which we will gloss over. So our students go into a wide range of different jobs, but as you can see, they are all sort of more community-based rather than health-based. Some of our students also use health and social care qualification to move on to further study. And the things that our students tend to do those in are things like counselling, social work. People often use it as a route into social work, mental health and substance use, psychology, PGCE, which is a teaching qualification, or MA in health and community development. And there are also quite a number of different graduate training programmes our students go on to. So things like NHS, graduate management training schemes, and some within the criminal justice system, but those tend to vary quite a lot each year depending on the funding that's available in those particular sectors. And I think that's it from me, but please do take a note of my email address, which is there. And if you have any questions at all you want to ask me about the course, feel free to get in touch and I can get back to you about those.
Amazing. Thank you so much, Zoe, and thank you so much, Alma, as well. I'm just going to open the Q&A section just to allow people to drop any questions they have in there, and then we'll answer the questions straight after for you as well. I have actually got one question. Could you just talk about maybe the balance for learners who are working and studying as well? What is that like for learners at your university?
It's useful to talk about the timetable actually and what the commitment is. So because our modules are 30 credits, they are taught for 4.5 hours over the week, but we'll put that into one day. So people will be required to come into university for 2 days in the week, and then they will be on placement for another day. We also have online individual tutorials, but they can be fitted in at various different times. So the commitment, I would say, really is 2 days a week in university and one day in placement. So in terms of working, obviously it can be a challenge juggling that with university, but most people can can fit it around those times. But I think it is challenging to fit it around a full-time job.
We've had one come through. It says, does this course offer accreditation with professional bodies?
No, it doesn't. No. The thing is with health and social care is it's so wide ranging. There aren't actually at the minute. They are being developed and they'll be available in a few years, but at the minute there aren't any what we call subject benchmarks like there are for lots of courses. And that's why health and social care courses vary so much around the country. And there are pockets of professional standards and professional accreditation in the field of health and social care, but because it's so wide ranging, there isn't one specific one.
Great, thank you for that, Zoe. You talked a lot about the placement and how much you kind of advocate for that as well in your program. What advice from you personally would you give students to get the most out of their placement?
To get the most out of their placement. To take every opportunity, I suppose, and be proactive when you're there, and to take it all on board. And any experience in health and social care is useful experience because what you're developing is those practical skills. So what's really useful is, for example, in one of the modules like the counselling and guidance skills, when we look at specific skills, some people then find it really useful. So whatever we've looked at that week, to kind of try that out in placement that week, so you can really put those skills into practice, and then people will come back the next week and said, "Oh, I tried using that with people and it worked really well," and so you can sort of feel your practice improving as you go along. And I think that's a really useful way to use your placement.
Great, thank you very much for that, Zoe. Another question regarding the top up, I guess the span of the program. Can it be done part-time over 2 years, or is it just 2 semesters?
No, it's only available over the 2 semesters. Yeah.
Had a couple more come through. One of them is regarding, does the program support placement? We've already touched on that. Does this program support international students?
Yes, we have a lot of international students on our course. So yeah, absolutely.
Perfect. And what is the mode of admissions and how many admission windows per year?
So we only have one September cohort.
Great, thank you for that. Just gonna wait a couple more moments for a few more questions if anybody has them.
What would be the best way for students to apply? Would that just be directly with the school?
Alma, is that a question for you?
Yes, everyone can just apply on the website.
Oh, great. Okay.
Rebecca, sorry, I don't know if you've just seen that question come through.
Oh yeah, I'll just read it. We are an institution in Dubai offering level 4 and 5 OTHM. I think should I connect with University College Birmingham if our students are interested in the level 6 top up. So I think Alma, you'd said just to go directly to the website.
Yeah, if students want to apply, they can just apply on the website. If they're an international applicant, that will come through the application process as normal.
Yeah. And then if you've got any additional questions, you've got Zoe's email there as well. For any course related stuff, isn't that right?
Yeah, absolutely.
Perfect.
We've had one come through. What is the tuition fee for the entire top-up program?
Yeah, 9790.
Perfect. And they can find further information on your website, is that correct?
Everything's on the website, that's right.
Perfect, thank you for that, Alma.
That's for home students, I should clarify. International students pay more.
Can the tuition fee be paid in installments?
Yes, you would need to discuss that with our student finance team when you enroll, but yes, it is possible.
Is IELTS or any other English language test mandatory for students who would like to take the top up?
Yes, it will be. If you haven't got recognized English qualification already.
I've had a question just asking, after completing extended diploma level 5, should I go for a top up in health and social care, or can I go with another related course like healthcare management?
We don't offer that at UCB, so I don't know, but I guess in theory you could, yeah.
Okay, so we've had no more questions come through. But as I say, if anybody does have any questions at all, please do get in touch with either the UCB team or OTHM. We're following up with an email with all the details for you. Thank you all so much for watching, and thank you to Alma and Zoe for joining us today. We really hope this has been an informative session for you. And please do remember to fill out the survey that will follow this webinar. And we wish you all the best and good day. Thank you very much.
Thank you.